Good morning, everyone. Today we'll have a few interesting cases. We have this case. It's a very, very fresh case of a young female with abnormal abdominal ultrasound for CT scan. Start with the first one. This is the arterial phase.
CT scan,
Good.
axial section of the abdomen, arterial phase. Hypodense
Okay.
lesion in the right kidney.
Okay. Yeah. What did you see? What's going on? What do you see? Come on, this part one case.
Dilated pelvic region.
Pelvic, you know, region?
لا, region of
Region. Okay. شوفي لي هنا. This is coronal reconstruction showing
multiple hypodense area, cystic hypodense area in the right kidney.
Really? Are you sure? زين ماشي. Okay, let me even help you more. This is venous phase showing what?
Hydroureter.
Girl, focus here. What's going on? Come on.
الهورسشو كدني
يا قوي.
اي connected يعني.
زين. Horseshoe kidney with
dilated
left, right, sorry.
pelvic
calcium system. ليش يكون dilated in a horseshoe kidney?
obstruction.
Due to what? شو يصير عندهم الهورسشو kidney ممكن one of the complications or one of the associated anomalies. Malrotation result in kinking. يصير نتيجتها شنو؟ Hydronephrosis due to some sort of kind of PUJ stenosis, something like that. Is this kidney right side functioning or not functioning? Functioning. It's excreting. So it's not an obstruction. It's stenosis. Okay, the obstruction يكون non-functioning أصلا. And what about the left side? It's also malrotator and hydropelvis. Okay, could be extrarenal pelvis, could be some sort of mild PUJ stenosis, pelvic junction stenosis. Okay, واضح ولا لا؟ Let's go. Let's see it in the وين الكورونا. هذا الكورونا أحلى من الكورونا ما أحلى. Why? It's malrotated. How many types of horseshoe kidney you know? It's very rare, but happens at the upper pole. Usually it's at the lower pole. The connection is how many types?
fibrous.
Maybe fibrous, maybe parenchyma. Okay, this is fibrous or parenchyma? Parenchyma, which is more difficult to treat surgically. Third, the most important question, is horseshoe kidney an easy diagnosis by ultrasound? Usually ultrasound comes normal. It's very difficult to see horseshoe kidney by ultrasound. So when you have a normal ultrasound and you do CT scan and there is a horseshoe kidney, don't say, who did this ultrasound? He's stupid. No, this is the usual story. It's usually difficult to diagnose by ultrasound, especially if it's fibrous. Excellent. Man-rotated, okay. But not always you can see the connection. And you should be like suspecting it until you see it. Okay? Thank you. This is a 42-year-old female patient presented with knee swelling. Then MRI of the knee.
Of knee, sagittal,
Good.
proton density,
Affair.
and
Fat saturated.
and history any history?
Knee swelling. Long-standing knee swelling. Not wrong.
There is fluid collection in
This is a collection.
يعني effusion عفوا.
Guys, ايش قلنا؟ خلونا أصدقاء.
joint effusion scene
تمام.
in suprapatellar.
Perfect.
bursai.
Good.
and there is لا هذا هوفا بات ساين.
شنو يعني؟
هوفا.
اوكي.
هوفا بات.
زين.
فات. الانتيريور كروشيت ليجامنت لوكس نورمال. والبوستيريور كروشيت ليجامنت.
اوكي.
نورمال.
اوكي. زين. شوفي other sequences.
Posterior horn here is normal. Anterior horn.
Good.
Of medial meniscus. This is the anterior and posterior horn of
ACL, PCL, medial, lateral meniscus normal. يلا let's do it. So till now we have joint diffusion.
T1.
T1, sagittal.
Sagittal.
Non-fat saturated.
Yes.
Axial, fat saturated, proton density images. Till now we have joint diffusion.
There is a discontinuation of the patellar cartilage.
Okay, some interruption of the articular cartilage of
medial
the patella.
side.
Excellent.
هذا ينحسب grade 1 fissure.
Okay, fissure. Do you think I will give you this case for patellar cartilage interruption?
لا هذا اكو joint effusion بس ليش اكو joint effusion لازم ندور على السبب.
زين. Nice. Good. Logical thinking. I like.
Yeah. هاي بلايكا.
Plaque. Okay. زين. Okay. Wait. Let's. What's going on here? لا تحكي هذا السلايد.
هو هذا density مال الفات.
أول شيء intensity مو density. ثاني شيء شنو هي الانتنسيتي اوف فات؟
هي لازم هاي بالتي 1.
اوكي.
Wait. يعني اقل ايزو بالتي 2.
less hyper.
less hyper.
اوكي. and
in fat sat لازم
تمام. هذا فات سات لو مو فات سات؟
ايه.
suppressed لو مو suppressed؟
no not suppressed.
so شلون تقول عليها فات؟
لا معناته
same mistake of last time.
لا يعني اريد
this is fat.
yes.
هذا نفس هذا؟
No.
Is this the same as this?
Not suppressed.
This is not suppressed. High first. Second, this is a T1.
T1.
It should be what?
Hyper.
Is this hyper?
No.
This is fat.
Yes. No.
Is this the same?
No.
So it's fat or not?
Not fat.
Not fat. So we have what?
Either blood
or
soft tissue.
Soft tissue what? Mass, lesion, nodule, pathology, something?
Yes.
صح?
Yes.
زين. So we have a lesion. Where is located?
Behind Hoffa part. يعني infrapatellar. Infrapatellar.
حلو. It appears on T1.
Hypo
to iso to muscle. Let's say iso to muscle, hypo to fat. Okay. On T2, fat saturated images.
Not suppressed.
It's not suppressed and it's hyper.
Hyper, yes.
Okay. Well defined, ill defined.
تقريبا well defined.
Let's see it on the axial images. Probably we can have better look.
Yes.
Well or ill-defined?
هو الحدود مبينة.
Well defined.
Well defined.
Okay. The question is, from where it's arising? Is it from the meniscus? Is it from the ACL? Is it from the cartilage? Is it from the bone? Is it from the capsule? يعني synovial.
To me, maybe from synovial.
To you, maybe
Maybe
synovial.
synovial.
Okay.
This is the lesion.
Good.
Here is the lesion.
Good.
This is the lesion.
So, is it arising from the bone?
It's not from the bone.
Is it from the cartilage?
Here.
The underlying bone and cartilage, are they normal or abnormal?
Normal.
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 Is
هو
it from
cartilage
the-
مبينة.
Is it from the ACL? Or it's separated from the ACL?
Separated.
Separated. Excellent. Is it from the synovium or separated from the synovium? Can you see fluid between it and the synovium?
No.
Good. So it's from where?
From the synovium.
From the synovium. So what's your differential diagnosis? We have all the
Synovial
criteria.
pathology.
Like? سكتوا كلهم. وصلنا للديفرنشال diagnosis صارت صح.
pigmented bilirubin هذا
PDNS. PDNS should appear what on?
كل cystic.
Should be blood
blood
content.
يعني إيه؟ blood
Does this have a signal of blood?
No.
Okay. That first one. Ganglion cyst. By the name, by definition, it's cyst. Is this a cyst?
No.
Okay, but this is a soft tissue. This is not a cyst.
Yes, this
Not
is
fluid signal intensity. Second. Third.
synovial
Synovial sarcoma. Good. Synovial sarcoma appears as, what are the criteria that's aggressive lesion? Is this an aggressive lesion? Good. It looks like a benign, حلو مرتب, clear, surrounding bone, no bone marrow edema, no obstruction, no invasion, clear surrounding soft tissues. بعد. يلا قولوا. It's up for open question. Donna, differential. Synovitis. By name, itis means inflammation. So, does this look like inflammation? It's clear surrounding, no edema, no surrounding edema, just a lesion sitting there. What about synovial hemangioma? Is it a possibility?
Contrast.
We should have contrast. Unfortunately, the patient refused contrast. طبعا no one asked for contrast. No one asked for an X-ray. دائما أقول لكم when you have an musculoskeletal image, you ask for an X-ray. I will tell you I don't have it, but you should ask for it. Okay. Then, could it be synovial hemangioma? One point, it should be hyperintense on T1 and suppressed, which is not the case here. And أعطيكم hint بعد, intraoperatively the lesion was bloodless. Not a drop of blood came out when they removed it. يلا.
Cartilage. فتشي مثلا synovial
Like what?
chondromatosis.
First you said it's not arising from the cartilage. So
from synovial.
let's stay with our original conclusion. يلا. Pathology came back as synovial giant cell tumor. Okay? Hemangioma or giant cell tumor? طلع giant cell. لأنه ما
وليش فكرت بالجاينت سيل يعني؟
What else? يعني from synovium. What else? What other pathology that is benign? It's benign. It's not malignant. Okay. At least allocortex seems to be benign. We cannot say 100%. And arising from the synovium. I couldn't, the patient refused contrast. She was afraid of contrast. So I couldn't exclude hemangioma. Okay. This is a 40 years old male patient. Okay. Presented with a long-standing history of dysphagia and things like that. Okay. He's 40 years old. He's healthy. Nothing there. So this exam was ordered. What's this exam? First name the exam.
Chest X-ray.
Chest X-ray. Good.
Why?
You tell me why. You don't ask me, you tell me.
Scanogram.
Scroll through the images.
Because it's obvious from the...
Scroll through the images.
Okay.
Scroll. Back.
Barium.
Salt.
Barium swallow.
This is a barium
Swallow.
swallow. It's not a chest X-ray.
Okay.
Okay? This is a barium what? Swallow.
Yeah.
Showing.
Okay, just showing dilatation of the esophagus.
Good. Dilated esophagus. Measuring maybe, I don't know, 4, 5 centimeter.
Yeah, exactly.
Something like that. So why it's dilated?
There should be an obstruction if it is dilated.
Okay. There should be some sort of obstruction.
Yeah.
Excellent. So where is the obstruction? Scroll.
It's obvious, it's up.
So the obstruction is up.
Yeah.
And the down is dilated.
Yeah.
So you have an obstruction up, the down will get dilated.
It shouldn't be.
Listen, use logic. We are swallowing food.
Yeah.
So the end of the dilatation should be the obstructed part. Okay?
Yeah.
So we need to look for the distal end of the dilatation. Where does it end? Not where does it start. Got it? Use logic. Okay. So what do we have here? Go another, maybe, no. Up. Okay, another one. And another one. No, بالعكس. يلا. Okay. Stop. What do we have here?
There is an obstruction here.
There is a narrowing.
Yes.
Okay.
A narrowing here.
Where, what's here? What do you call that?
Gastroesophageal.
Gastroesophageal what? Junction. Gastroesophageal junction appeared narrow.
Narrow.
So why do you think is that?
The cause of narrowing?
What's your differential diagnosis, let's say? Yeah.
It looks like achalasia.
Why achalasia? Why you said achalasia? Why not, I don't know, gastroesophageal carcinoma, for example?
Mm-hmm. Can we exclude from here?
Yes, we can. And there are not one, there are multiple clues to the exclusion. Yeah. Give me these clues. First.
It's the narrowing is like smooth narrowing, taper.
It's smooth narrowing.
Yeah.
What's the name of this sign?
Bird's beak sign?
Bird's beak or rat tail appearance. Okay. It looks like the tail of the rat. This is the rat and this is the tail.
Mm-hmm.
First. Second. I told you he has long history of dysphagia. Carcinoma will not have. Then, if it's esophageal carcinoma, what would be the appearance?
It will be irregularity.
Shouldering. Yeah. Okay. So this is a rat tail appearance of achalasia. Surprisingly, this after 3 times of endoscopic dilatation, and he gets back to achalasia, and they do dilatation, and he gets back to achalasia, and they do dilatation, get back to achalasia. What kind of achalasia would you expect? Primary or secondary?
I don't have information about this.
In our part of the world, it's primary. Okay. In the South American parts, it's secondary to what? What kind of pathology? It's not carcinoma. So stomach, that's Chagas disease. Chagas, parasite. In South American region, they cause loss of neuro cells in the gastroesophageal. It will not relax. Again, 32-year-old
Okay.
female patient, abdominal pain. What's the exam? What's the exam?
It's pelvic X-ray.
Okay, pelvis. Scroll. Is this how you see pelvis in the...
No, abdominal.
So, what's the exam?
Abdominal X-ray.
بس؟
Again, barium?
طبعا. What kind of barium?
Barium enema?
Barium enema. Excellent. Barium enema. Showing. What? Stop here.
Here?
Here.
Okay.
Yeah.
There is dilatation of the ascending colon.
This is the ascending colon. You see the ascending colon first in barium enema?
No.
You're doing enema.
Yeah, exactly.
So what's first thing you see?
From here.
Guys, what's the first thing that...
Sigmoid.
Rectum, then sigmoid.
Sigmoid colon.
Okay, so showing what?
Dilatation of the sigmoid colon.
Of the sigmoid. Where is the sigmoid? This is rectum.
Rectum.
Then this is sigmoid. And then we will go to... What's this?
Descending.
Descending,
Yeah,
then transverse, then ascending. Good. So here we have the sigmoid colon dilated. What else? What's going on?
There is a structure here.
Excellent.
Structure.
What kind of structure? What do they call it? Apple core lesion. This is an apple typical, best apple core lesion you will see in your entire life. That someone eaten the apple from here and here and they let the core. What's the differential diagnosis of apple core lesion?
Carcinoma.
First of all, sigmoid or colon carcinoma. And what else? Crohn's cause continuous loss of hostration or striation or whatever. زين بعد. This is a 32-year-old female. Lymphoma. Endometriosis, one of the very common causes of apple core lesion. Don't forget endometriosis in females. I don't know what this case turned out to be. I'm just saying the differential diagnosis could be a very common cause of apple core lesion is endometriosis because sigmoid colon is very close to the colon, you know. So keep that in mind always. It's not always colon cancer. Most of the time, but not always. Okay?
So, but why the distal parts are distended?
Because we inject contrast. We inject contrast cinema. So we have to distend it. Normally, it should be distended.
It distends to this level
Yep.
when you distend
The contrast.
Here it's obstructed or narrowed. We are injecting contrast. It gets distant and the contrast will pass slowly distal to the obstruction. So, and we can see the rest of the images. You know, for me, if I have this appearance, I stop the exam. That's it. No need to see the whole colon. I have the apple core lesion like, yeah, shouting. Helminthoma. Helmin? What's helmin?
Parasite.
It's like some sort of collection of worms. طبعا اكيد تي بيسوي. Radiation. Post radiation. لازم عندك history of radiotherapy or يصير fibrosis. But usually it's long segment radiation. ما يسوي focal segment. هذول كلهم causes. Yes, they all of these, but the ischemic colitis also long segment, rarely causes narrow segment. Okay? Crohn's disease, chronic ulcerative, most of these are long segment involvement. Short segment, endometriosis, colon carcinoma. صح؟ تمام. Thank you very much. See you next week.